Hello, my name is Morag Mackay, and I'm Director of Research at Safe Kids Worldwide. It's my pleasure today, on behalf of our President, Toreen Kreppy, to give you an overview of our organization. Safe Kids' mission is to keep all kids safe from preventable injuries. But how did we come about? We are a not-for-profit that was started about 34 years ago by a pediatric surgeon who got tired of having to come into the waiting room and give parents bad news. He felt there had to be something that could be done upstream so that he wasn't having to treat children as a result of these terrible incidents that were occurring. And he decided to start to build a campaign and a network across the country. And today, Safe Kids in the US has over 400 coalitions across the country, delivering that same prevention message to parents. But what does Safe Kids mean when they speak to preventable injury? Well, we talk about unintentional injuries. So we are dealing with the results of motor vehicle crashes, suffocation, drowning, poisoning, pedestrian, fire and burn related injuries. What we don't cover are things like bullying, self-inflicted injury and suicide, child abuse, etc. But even when we're just looking at unintentional injury, it is the leading killer of kids ages 1 to 19 in the US, and that we know that the fatalities are just the edge of the iceberg or the tip of the iceberg, and that millions more children are seen in emergency departments each year. And one of the other facts that really surprises people is, even though we have this issue as large as it is in the US, high-income countries like the US make up only about 5% of all unintentional injuries. So 95% of unintentional injuries are occurring in other parts of the world. And we know that it is a global epidemic and that more needs to be done. And one of the things that we can do in the US is share what we learn, what our best practices are, and the results of research that's done here with partners in other countries to help them begin to address this important issue as well. Since Safe Kids was initiated back in 1988, there has been over 60% reduction in fatal injuries. And while we cannot directly link ourselves to that, we know that we've helped contribute to that. And we do monitor this trend just to keep an eye on where we're at in terms of reducing fatal injuries in the US. Obviously, that reduction has been done in partnership, and in addition to many national level partners that we work with on developing programs and getting information out to families, it is our network of over 400 coalitions across the country who really are the boots on the ground and are the ones that assist in or are delivering that education, building that public awareness, working with local partners to do environmental modifications, working at the state level on legislation to prevent child injuries or support preventive environments. So this network forms the workforce, if you will, of our organization, but they are in fact independent entities. They each have a lead agency who has signed an agreement with Safe Kids and agreed to work with us, but they are also doing all sorts of other work as well with local community partners, in addition to the work that they may receive funding for from Safe Kids. I've alluded to the fact that this is a global issue, and in addition to our coalitions, we also have a worldwide alliance where we currently have partners in over 30 countries participating, and we are just launching a revamp of that alliance and are looking to expand partners in parts of the world where we don't currently have them. But let's go back and talk a little bit more about our local coalitions. We have a coalition in 49 states. The only state we don't currently have a coalition in is South Dakota. So 49 states and the District of Columbia all have a coalition. As I noted, they're each led by a lead agency and those lead agencies can be a children's hospital, a community hospital, a health department, or some other community-based organization, and they provide staff and operational support for the activities. The coalitions build that community group and are made up of nurses, police officers, firefighters, paramedics, doctors, teachers, business leaders, legislators, and parents, but they also pull in an incredibly dedicated group of volunteers to assist them with their activities. And really, it all in all forms this amazing network of individuals, all with the common goal of keeping kids safe from unintentional injury. So how does Safe Kids work? We basically work in 4 areas. We start with research. We look at collecting and analyzing primary and secondary data to really try and understand the injury issues that we're working on, but also look at research and evaluation methods to help measure the impact of the work that we're doing. The information that we pull together helps inform the development of programs designed to reach parents, caregivers, children, and other educators. We also do advocacy, as I alluded to, both at the state level, but also at the federal level to advocate for new and improved laws. And then we also work at delivering consistent, compelling messaging that will engage people to start to think about the issue, start to think about their current behavior and how they might change it in order to keep kids safe. In terms of where we focus, we provide resources to deliver community programs in 3 areas: at home, at play, and on the road. For at home, it covers safe infant sleep, fire safety and burn prevention, water safety in the home, in and around the home, poison prevention, including medicine safety and falls prevention. At play includes water safety, and here we're talking more at play out in the community or out in open water, sports safety, and wheel sports safety. On the road, we talk about child passenger safety, pedestrian safety, teen driving safety, cycling safety, and rail safety. So what does one of our campaigns look like? I've got an example here using medicine safety just to illustrate how we work to engage partners and to get information out to families that need it around particular topics with respect to child injury prevention. So we start, as I said, with research to try and identify the risks and frame the issue. And we are often putting out the results of that work in form of a research report that can be used by community partners and the media to highlight the issue and begin to direct educational activities. Those research results are used to develop prevention strategies to begin to mobilize our coalitions and figuring out the best way to engage with those families where they are. We do this in the form of direct education, so that might be prenatal classes, that might be education in the classroom for children, and certainly over the last 18 months with COVID, a lot of that education has been done virtually. But we also participate in a lot of community events such as health fairs, where we are there to help raise awareness of the issue with interactive activities to engage children while someone else can have a great conversation with the parents about what the risks are and what they can do to reduce them. We also advocate for child safety through policy. So with respect to the medicine safety issue, which is the case study here, we have been advocating for some time for additional funding from Congress for poison control centers who provide an invaluable service across the country for parents when a child does get into a medicine and they're trying to figure out whether they need to go to the ER or what the next step should be. We look at expanding reach through partnerships, and that occurs both at the national level, but really importantly at the local level, where the coalitions are bringing in additional partners to try and expand the reach that we have within the medicine safety program. One of the examples is bringing in pharmacy students and having them go out into the community as part of their educational process to actually educate school-age children. And finally, we really engage through digital and traditional media, whether that's television or radio tours, articles, or digital activities through Facebook, Instagram, LinkedIn, etc. In terms of our reach, our social media channels have a pretty strong reach. We are not necessarily a recognizable brand in the sense that someone says, oh yes, Safe Kids, and everyone knows who they are. But those that interact with us regularly come back again for information, and we have a very healthy following on all of our social media platforms. We are funded for the most part through corporate sponsors, although we do have some government grants as well as individual giving. But we have some funders that have been with us for a very long time, such as our founding sponsor, Johnson & Johnson, and one of our current signature sponsors, General Motors, who has been with us for over 20 years. We find that sponsors come to us and often stay with us for quite a while because they see the value in investing in the future of children. And really that's what is at the heart of Safe Kids Worldwide, is ensuring that we invest in parents so that they can keep their children safe, so those children can grow up and be contributing members to the society. So that gives you an overview of Safe Kids. If you have any further questions, please don't hesitate to go to our website, www.safekids.org. And you've got a full list of staff on that website, and we would be happy to answer any further questions that you might have about Safe Kids. Thank you for your attention.